61. What is the primary physiological effect of the sympathetic nervous system during the fight or flight response? A. Constriction of bronchioles. B. Decreased heart rate. C. Dilation of pupils. D. Increased digestive motility. Answer: C. Dilation of pupils. Rationale: the sympathetic nervous system dilates pupils during the fight or flight response to enhance visual perception. 62. In maternal and child nursing, what is the primary role of oxytocin during labor and postpartum? A. Uterine contractions and milk ejection. B. Fetal lung maturation. C. Placental detachment. D. Cervical dilation. Answer: A. Uterine contractions and milk ejection. Rationale: oxytocin stimulates uterine contractions during labor and promotes milk ejection during breastfeeding. 63. A patient with type 2 diabetes mellitus is prescribed metformin. What is a potential adverse effect of metformin that the nurse should monitor for? A. Hypertension. B. Hypoglycemia. C. Lactic acidosis. D. Hyperkalemia. Answer: C. Lactic acidosis. Rationale: metformin use may lead to lactic acidosis, especially in patients with impaired renal function. 64. During a pediatric assessment, the nurse observes a child demonstrating the pincer grasp. What developmental milestone does this indicate? A. Crawling. B. Walking. C. Grasping objects with thumb and forefinger. D. Rolling over. Answer: C. Grasping objects with thumb and forefinger. Rationale: the pincer grasp is a fine motor skill where a child uses the thumb and forefinger to grasp small objects. 65. Which component of the blood is responsible for carrying oxygen from the lungs to the rest of the body? A. Platelets. B. White blood cells. C. Red blood cells. D. Plasma. Answer: C. Red blood cells. Rationale: red blood cells contain hemoglobin and carry oxygen from the lungs to the body tissues. 66. A patient is scheduled for a magnetic resonance imaging MRI scan. What information is crucial for the nurse to obtain before the procedure? A. Allergic reactions to iodine. B. Presence of metal implants or devices. C. Recent intake of pain medications. D. Current respiratory rate. Answer: B. Presence of metal implants or devices. Rationale: metal implants or devices can interfere with the magnetic fields during an MRI scan, so this information is crucial. 67. In pediatric nursing, which age group is characterized by the eruption of deciduous primary teeth? A. Infant 0-1 year. B. Toddler 1-3 years. C. Preschooler 3-6 years. D. School-age child 6-12 years. Answer: B. Toddler 1-3 years. Rationale: deciduous teeth typically erupt during the toddler years 1-3 years in children. 68. A patient is prescribed an angiotensin-Roman II receptor blocker ARB. What is the primary therapeutic effect of this medication? A. Vasodilation and blood pressure reduction. B. Increased heart rate. C. Inhibition of platelet aggregation. D. Enhanced diuresis. Answer: A. Vasodilation and blood pressure reduction. Rationale: ARBs block the effects of angiotensin-Roman II, leading to vasodilation and a reduction in blood pressure. 69. During the postpartum period, what is a common psychological adaptation that may occur in new mothers? A. Decreased attachment to the newborn. B. Feelings of sadness and mood swings. C. Excessive worry about the baby's health. D. Lack of interest in self-care. Answer: B. Feelings of sadness and mood swings. Rationale: postpartum mood swings and feelings of sadness are common psychological adaptations in new mothers. 70. Which physiological change occurs in the respiratory system during pregnancy? A. Increased tidal volume and oxygen consumption. B. Decreased respiratory rate. C. Lowered diaphragmatic excursion. D. Diminished lung capacity. Answer: increased tidal volume and oxygen consumption. Rationale: pregnancy leads to an increase in tidal volume and oxygen consumption to meet the needs of the growing fetus.